Hi everyone, my name is Agnes Zhu and I'm an M2 from the Mayo Clinic Alix School of Medicine. And today I will be presenting on the Pre-Med Insight Mentorship Program. So first, for some background, as many of you know, despite the widespread acknowledgement of the lack of diversity in medicine, the racial and ethnic composition of medicine has not changed substantially in the past few decades. And though I've found some studies that have looked at different programs addressing barriers to pursuing careers in medicine, there are very few focused on longitudinal undergraduate programs, especially those in the virtual format. So the purpose of my presentation today is to share the pre-med insight model, as well as evaluate some of the strengths and weaknesses of transitioning a previously fully in-person program to a fully online format. So first, for some background, Pre-Med Insight, or PMI, is an annual program that is hosted by Mayo students for underrepresented and or financially disadvantaged undergraduates and post-bac students. This program consists of two parts. One is one-on-one mentorship pairings with medical students, and the other is 5 workshops. On the left here in the description, I've also included some demographics if you're interested in reading a little bit more of what our students typically look like and who they are. So I wanted to share with you today the 2020 to 2021 PMI program outcomes. So as I mentioned, we typically have a fully in-person program, but in 2020, because of the COVID-19 pandemic, we had to move that program to a fully online format. For some of our programming, this didn't have too much of an impact, such as the one-on-one mentorship programming, but for other parts, such as our workshop, this had a big change. So typically we have students attend our 5 workshops: different faces of medicine, how to get into medical school, diversity in medicine, surgical skills, and teamwork in medicine. So for some parts of these workshops, such as lectures or panelists, there wasn't too much an issue transitioning to an online format, but for some others, we had to be a little bit more creative. For example, for our How to Get into Medical School workshop, we organized a multiple mini interview session. For the session, we enlisted 7 medical student volunteers to be the interviewers, and they presented a prompt of their choice. So the way the MMIs worked out is each MMI took place in 7 different breakout rooms. In each breakout room, there was 1 medical student interviewer, 1 PMI leader, and 4 to 5 students. The interviewer would then share their screen displaying the prompt, and each room would follow the same schedule. For the first 2 minutes, everyone in the breakout room would read the prompt and prepare the answer as if they were the interviewee. Then at the end of that 2 minutes, 1 student was chosen to answer the question. For the next 8 minutes, that student would answer the main question and any follow-ups from the interviewer. And then for the final 2 minutes, everyone gave some feedback. The interviewers were then moved to a different breakout room by the Zoom host, and the process was repeated until all students had at least 1 opportunity to be the interviewee. We also had to move our surgical skills session to a fully online format, which was a little bit more tricky. So for that workshop, we individually mailed suturing kits to each student and then had them view video tutorials before the workshop to prepare for the session. During the workshop, we had medical students teaching knot tying and suturing over Zoom in different breakout rooms. Overall, this was received really positively, with students loving the hands-on format. However, some students did mention that they struggled to follow along and get a good visual through the Zoom screen. Finally, we weren't able to include some of our typical sessions, such as ultrasound or laparoscopy, because those are harder to transition to a virtual format. And then finally, I wanted to share some of the innovations of our students. As part of our program, PMI students are required to engage in team community service projects. So typically, students will work together and go out into the community and volunteer, but obviously during COVID, that wasn't possible. So a few students had some really innovative ideas that I wanted to share here. On the left here, you can see a student who knitted several mask extenders that they donated to local healthcare providers. And then on the right is an example of a surgical cap, one of many that a student sewed and then donated to the local children's hospital for pediatric patients. And then on the bottom of the screen here, you can see just an image of one of our virtual workshops. So in conclusion, I think what we learned is that some PMI workshops were actually enhanced in the virtual setting, such as our MMI session, but others, such as our surgical skills workshop, would have been better if they had been still in the in-person format. Right now, for the 2021 to 2022 program, we are hosting this in a hybrid format. And we're also continuing to conduct projects to evaluate the efficacy of PMI, as well as the strengths and weaknesses of moving to a hybrid and or online format. But in the end, I hope that PMI can serve as an example to aid other institutions in refining their existing programs, transitioning programs to online, or starting programs from scratch to benefit underserved individuals interested in medicine. By successfully making our workshops and resources available to underserved and underrepresented students last year, we hope that we can help continue diversifying the medical school pipeline, regardless of future restrictions to in-person activities. So thank you so much for listening today.